This podcast is intended as healthcare practitioner education only and is not a substitute for medical advice, diagnosis, or treatment.
I hear the same story over and over again, which is I didn't really think about it. You know, the nurse came in and already had the vaccines drawn up. It seemed like that was what was to be done that day. So I didn't really object.
Certainly, it might probably be easily probably the biggest decision you probably make throughout your lifetime.
If it's your child, you're the one that needs to weigh up those risks and benefits, because whether there is a vaccine injury or whether you get the disease, there are risks on both sides.
This is Bioconcepts Between Clinical Minds, the podcast that's open-minded enough to take in all sides of a clinical story. You'll hear from researchers, doctors, naturopaths, nutritionists, and patients. We look at common clinical presentations through a different lens. It's open, frank, and sometimes controversial. Nothing is off limits. Will it change the way you treat? We'll leave that up to you. In Season 1 of Bioconcepts Between Clinical Minds, we look at children's health. We talk to experts in the field who will take you into their clinics and share their experience. We'll hear the inspirational stories of change from patients and their families along their healing journey. I'm Tony Chambers, and this is Bioconcepts Between Clinical Minds. Over the next 2 episodes of Between Clinical Minds, we brave the topic of childhood vaccinations to try to provide a guide on how to traverse the issue with parents. We speak to US paediatrician Dr. Elizabeth Mumper, naturopath Amanda Howe, and a parent who has navigated the space with his own children. The topic of childhood immunisations is extremely emotive and controversial, almost like the old adage, never talk about religion or politics at a dinner party. We can now add vaccination to that list. The aim of this episode is to explore the topic and provide some guidance on how to work with patients regardless of their decision. Dr. Elizabeth Mumper is a well-known integrative paediatrician from the US. She's developed her own delayed vaccine schedule that's often followed here in Australia. She's all about informed consent.
And to me, this is the parents thinking about the decision ahead of time, the parents coming to some kind of consensus ideally, and not a situation in which they show up for a doctor's visit, are surprised to find that a certain vaccine is due that day, and then quickly being asked to just sort of passively agree to have the nurse or medical assistant give that immunization. So I'm aware of the schedule in the United States. The last time I was in Australia, it seemed like the Australian schedule was very similar, but I also knew that there were some incentives in place for people to follow the schedule, which included things like access to state-supported childcare and education. So it's a matter of looking at the whole situation and not just making a snap judgment.
And how often do you think parents do turn up to that regular checkup and only to find out that today is actually the immunisation day? Do you think that happens in a lot of cases?
Well, I don't think it happens much in my practice because of the way that we start talking about vaccines at the first visits. And typically when we end a visit, we'll say something like, now ordinarily the meningitis vaccine would be due at the next visit. So I want you to do a little bit of research and think about that and talk it over with your partner. I will say that looking historically at many of the patients that I see in my specialty practice, which is advocates for families, which tends to deal with children who have autism or children who have complex chronic illness, I hear the same story over and over again, which is I didn't really think about it. The nurse came in and already had the vaccines drawn up. It seemed like that was what was to be done that day. So I didn't really object. And again, I just want to emphasize this concept of informed consent. If you wanted to have surgery, the surgeon would give you a piece of paper that explained the complications potentially of the surgery that you're about to have. I think that physicians have maybe not done as good a job at really making parents informed about the potential complications. There is a vaccine information sheet that is prepared by the Center for Disease Control that does list some of the complications, but the CDC is in the business of approving vaccines for distribution as well as informing people about risks. So there's a little bit of an inherent conflict of interest, and people may find that the vaccine information sheets don't give them quite the information that they want in order to make a good decision.
So where do you direct your families to find that unbiased information in order that they exercise their informed consent?
Well, I will say that I think it is hard to find unbiased information. So I think that the best we have at this point in time is to look at both the agencies like the American Academy of Pediatrics and the Center for Disease Control, who in general are going to be on the side of promoting vaccines. And then there are several resources that families can look at that have raised concerns about vaccines. And I would like to make the comment that just because people like me are concerned about vaccine safety and informed consent does not justify us being dismissed as anti-vaxxers. So, for example, Barbara Loe Fisher established an organization back in the 80s and 90s after her son had a vaccine reaction and developed some neurologic side effects that seemed to me, having looked into it, that were very likely to have been an adverse vaccine event. Her site is called the National Vaccine Information Center, NVIC, and that has a lot of data about the concerning side effects of vaccines. And she's very careful with her staff to post published research as well as legislative updates. Dr. Sherry Tenpenny has a website in which she has done a lot of research about the potential downsides of vaccines. And that information is open to the public, as well as some training sessions where especially clinicians can delve more into the hardcore science. And then an organization that I work with, which is called Children's Health Defense, which was started by Robert F. Kennedy Jr., and many people on the staff are friends and colleagues I've worked with for the last 20 years. On that site, they have made a commitment to assemble the scientific papers that look at vaccine safety concerns. So those parents with scientific backgrounds or friends and colleagues who have scientific backgrounds can go back to the original science papers and to some extent make their own judgments about the course forward. I do think somewhere in this equation, it's good if parents have a clinician that they trust who can help advise them. But I do think that it is a matter of looking at both the pros and the cons in terms of examining the literature.
And I'm interested in your comment around being labelled anti-vaxxers, and I suppose that does do damage to families wanting to kind of seek unbiased information, or not even not unbiased, but both sides, pros and cons, as you say. It is damaging to those families wanting that information, isn't it?
Yes, and it's also damaging to the doctors who are trying to do the best for their patients, because once they make statements that are publicized that they have some concerns about vaccine safety, or that data from their practice suggests that too many vaccines given too soon all at the same time may be harmful, they tend to have their remarks labeled anti-vax. They tend to be called names, and they tend to have their reputations harmed. And in some cases, they are investigated by boards of medicine with not good outcomes.
Can we just first of all start by getting an understanding of who's in your family?
Obviously myself, my wife, and I've got two boys. One's 6-year-old and one's a 9-year-old.
Max is a father of 2, and he's taken the issue of childhood immunisations very seriously.
Certainly, probably easily the biggest decision you probably make throughout your lifetime, because I think as a parent, it's just this biological impulse of wanting to protect a child and to look after that healthy of a child, and just that's anticipation, wanting a healthy birth and a healthy child, and for all their prospects. And so a topic like vaccination is incredibly, maybe possibly sometimes maybe more polarising, but certainly it is one of those topics that is so important to take in as much information as much to take on, because that whole concept of it is there also developed to protect your child, to actually have your child protected from these diseases and these challenges there. Equally, it's something where we sort of need to investigate that process, and is it also going to be beneficial, or is it actually going to be detrimental to your child? Either or, I think parents have the same impulse. They want to ensure that intervention is going to do something positive, and not want that intervention to create something negative or a negative experience out of that as well.
As a parent, why do you think that this issue is so polarising?
It's a very good question. I honestly don't think I've got the answers for that. But I do think at the end of the day, it's coming down to the common denominator of having something that's designed to protect, or wanting to protect your child, at the same time something that potentially can or does damage or cause challenges to children around the world. And so I think both of them can draw equal emotions out when the topic is raised. And I think as societal pressures have gone on, the way things have come in from sources of media and the medical communities, or particularly more media strongly, there's been a lot that has created narratives, or created ideas, or created very, I suppose, points that does implant into people's minds that, if you don't do it, then you're going to potentially have a risk to others, and potentially a risk to other children. So when a parent feels that another child can be bringing their child at risk of a very serious disease, if not death, it naturally draws out very deep and very strong protective or other forms of emotions there.
Why is this such an emotional issue, do you think, Dr. Mumper?
Well, I think that for a parent who took a child in for a well child checkup and felt that their child was doing very well, and the clinicians seemed to confirm that they were healthy and developmentally normal, and then they receive a bunch of vaccines all at the same time, and the parent perceives that they change after that, I think that there is nothing more precious to most of us than our children. And many people will make the comment, I would die for my child. I wish this reaction had happened to me instead of my child. So that is tapping into a very primal instinct, maternal instinct to protect the child or the mama bear to protect the cubs is one of the strongest forces in the universe. And you don't mess with mama. And people's perceptions, I think, should be given the benefit of the doubt. Too many times if a mother says, my child goes to the ER, for example, and the child has a high fever and a seizure, and the mom says, we went to the doctor today and my child got 5 vaccines. Too often the reception that's reported to me is that clinicians may say to the mom, well, just because it happened today doesn't mean it caused this. This could be a coincidence. But many times the mother's gut or their instinct is going to be telling them, it seems like a really big coincidence, and I know my child better than you do. So that is part of what arouses emotions.
Max agrees and says his quest to find out more about childhood immunisations began with his wife's maternal instinct.
I think there's something that has developed civilization probably more powerfully than anything, and that's probably parental instinct, but I think probably even more close to maternal instinct. I think that is the most underrated, and I think if science actually went behind maternal instinct to really understand how it works, is a very, very powerful indicator, and that does bring up that very, very deep, very strong instinct not to do that. More so with our first, not so much with our second. There's probably a sense in her that probably the second probably could go through it fine. We haven't done that choice, but definitely the first, and I back this up as well because all the health complications that we even have, even though healthy diet, healthy fortification, we still have health complications with our first, and it's all immune-based. And despite shifting diets and getting rid of glutens and getting rid of wheats and reducing slim foods and doing all these things, we still have a child that is just born vulnerable and can show that in the susceptibility to a whole series of allergy tests, and the dust mites are through the roof, and this is. So we know and instinctively knew this quite some time ago, and even before birth, she felt that very strongly. Just we need to get this decision really worked through, but she felt this much earlier on, much more than I did. I didn't quite cotton on until I really started having these sort of deeper dialogues. I thought, okay, well, let's start to explore and go down this path and start getting more information. But I think the maternal instinct is an incredible guiding force. I think what one must distinguish in that is that there's massive vulnerabilities in parents and first parents, the first children there. We equally have this massive vulnerability that we're so fearful. I mean, I acknowledge my fear, just being fearful that the child comes down with something, oh my God, this could be meningitis or something like that. I think, and I really acknowledge my own fear of having a detrimental health outcome. So I think maternal instinct is quite interesting because maternal instinct might say, I have to go in and vaccinate. That could be, I'm really fearful because I've been told that if I don't do it, my child will die. I've been told that children die if they don't do that. That can influence that or put seeds of doubt or at least influence that sense of what we do believe maternal instinct is all about. So I think it's a real thing. I think it's a very, very powerful force. I think it can be influenced very detrimentally because we're so susceptible to fear, and that can sway that instinct very, very heavily there. Certainly, in our case, that was a very strong guiding path that really, I suppose, livened me up to kind of go, okay, I need to look into this.
I think you've raised a really good point and maybe does go to the heart of why it is so emotive, particularly around childhood vaccinations. But for you, I guess the issue is all around, for everybody, not just for you, the issue is around informed consent, isn't it? It's being able to look at lots of different sources of information and to make a decision that you're comfortable with for your family. So what was that process for you?
What drew me into this whole, I suppose, looking into this area is probably a reflection of my own family and seeing the health vulnerabilities in my immediate family, my family history, and there is a lot, and it is a very, very high risk factor for my family. So immediately I was at this default position, knowing that there's a genetic and also environmental high susceptibility for my children, at least from a family history health perspective. But I knew I had to look into this. I knew I could just default into this position of just go along with it and, it should be fine. Everyone tells me it's fine. The doctors, enforce it. Everyone agrees that it's safe and things like that. I had to look at it from very, very, differently at that time. And I think in my earlier years, I had a really, I suppose, unique opportunity because I built very strong rapport through my job and my profession. To have a lot of very close doctors and specialists and paediatric medical specialists that I built rapport in those years. And as I was sort of beginning to go down this path of exploring, the risks and benefits and what is it all about and what really happens, I had the opportunity to have some really good open dialogue, almost friendship dialogues or almost professional dialogues with a series of medical professionals that I highly regarded and certainly were very good in their areas, who actually told me something very differently from what I was hearing from the media. And in their perspectives and maybe from their research or their scientific research or maybe from their clinical perspectives, we're basically seeing challenges and dealing with those challenges in their practice. And I certainly got to the point where I had to sort of, I was open enough to speak about my family history. And I remember asking a question to a medical doctor and just saying, look, if you're in a situation like this with what you know, and it was your child, what would you do for your children? Rather than trying to sort of say, hey, make my decision for me. And I was just absolutely shocked by I say shocked, but I was really intrigued that there was so many medical professionals, at least in confidence, speaking out about the challenges and the real detrimental side of vaccination at that time. And that sort of just began to really open my mind.
Where else did you go for information at that time, given you had some knowledge about your family history?
Look, I was this type that, and probably, it's probably been my own personality. Once I'm sort of onto something, and particularly as the topic is so paramount to make, I just went everywhere I could. There was back at that time, there was certainly a lot of books and references, even again from some of those medical doctors, what they recommend me to start to read. And there was a lot of published, basically books with certainly well-renowned authors behind them. I remember there's a book that had about 400 peer-reviewed scientific literature publications in it that I purchased from. That was sort of referencing, vaccination. There was a vaccination friendly plan from a well-known American doctor, and really I think at that time there was a lot of YouTube clips, particularly to medical doctors who were speaking about and actually showing. And I was again being this personality type that likes this. I was watching presentations where they were presenting the scientific literature in their presentation and going through it there and kind of going, gee, this is all in the published literature. We're not talking about some obscure little, someone's little opinion over here. This is all in the scientific peer-reviewed published literature. And I remember in those early days, going through these presentations, and there was an article in there that really intrigued me, and knowing how to access these articles, and I just went off and downloaded these articles and had a whole pile of them and read them separately. Just read them there, and you can see the conclusions being made on those doctors presenting the challenges of vaccination and reading those couple of papers myself, and just going, wow, this is all here. Like this is not something that you have to go and find it in some obscure little published alley somewhere. Like this is something rich in the published literature that's all there. Why aren't we understanding this? Why isn't this implemented into some medical system of information that we're receiving this and kind of going, okay, there's a little bit more for us to consider.
So in the end, after you did all of your research, what decision did you make on this?
With particularly my eldest, there was, there were birthing complications. You start out with this beautiful plan of natural birthing and the reality of the difficult birthing process turns into epidurals and everything unnatural. But that's just the process there. But I think the decision is really, for myself going through that decision was like, I really felt that there was just this strong vulnerability with my family. And I think, you almost have to look at it and go, I don't see my child being a typical child in public health policy. I see my child as being a very susceptible child. I can at least feel I can make that, I suppose, that assumption or that decision based on that immediate family challenges that were there. And I really felt, and again, having a strong medical doctors and other health professionals that are highly valued to help guide me through that sort of process, it made it very clear for me that I really need to pull back on this. And if I was going to do it, I have to do it on a much more slower level or much more considered level. At that time, that was definitely an option that was put on the plate. Do we just take it a bit more slower? Do we just still go down the path, but do it at a maybe more of a slower way and just sort of assess that? But even that decision is not built much in science. We really don't know, whether even slowing down the vaccination process, or my interpretation of the science and what I've read, I don't know if that process is still going to give you a favourable outcome. But I think in the end, it was almost like, okay, looking at the vulnerability and also equally looking at all the public health data, not saying all of it in totality, but looking at the public health data and seeing the public health statistics showing that some of these diseases like measles and whooping cough and these other diseases were very much, the mortality, the death of them were well and truly established on the much decline before mass vaccination programs got put in place. It doesn't say that they went away. It just means children being dying from them were becoming much, much less. And you can see all this stuff, and you have to evaluate what's Australia's risk to these diseases like, and what is the death count is. What would I do if my child does get something? How would I approach it then? And look, I think the end decision for me was never absolute. I can't absolutely say that this is always the best decision for my child. I can't absolutely say if my child went through vaccination, they will have health problems. They could go through it and come through it fine. But somewhere along the line, you just got to make these decisions at these times and put all that information up and just kind of go, okay, we're going to go down this path. We're going to accept the responsibilities for the risk and potential benefit, or at least the risk for it. We're going to accept that. And we're going to go down this path and continue researching this area, continue looking into it there.
So have you ever been faced with a situation where your child's had one of those childhood illnesses that the vaccinations are meant to be for? Have you ever been faced with that situation?
No, I haven't. I have spoken to a lot of other families over my time who have had a child who's come down with whooping cough, or maybe more the chicken pox and whooping cough are probably the ones more common. There's measles is a bit more, it is a bit more, I suppose you say, rarer. I mean, you do get, the adolescent or young 20s who go over to, the Thailand, often coming back with issues at that time, back in the population. But no, we haven't had that. But I felt there has been those circumstances when the child does become unwell, and the challenge is you have to sometimes immediately jump to the conclusion this could be very serious. You have to be all on very, very high alert. It's a very awkward and very uncomfortable feeling as a parent. You have to almost be checked. You check for rashes. You check for purple rashes or colorations. You become very, very hypervigilant, which isn't comfortable, but it's the position you have to take there.
It's something that you kind of are doing ongoing research into. Is that accurate, that it's not really completely over for your family yet?
I recognise I'm limited in my capacity to understand all the literature, and I don't pretend I fully understand it either. But I'm always on this quest to really understand this sort of further, because the environment's very hostile, and I feel like I really need to, at times, I feel for my own self-worth or own self-need. If I'm ever confronted by a medical doctor, my child has to go to hospital or things like that, I feel like I need to really understand my information, so at least I can have just an open conversation, or at least sort of state some of the concerns and be able to be very up to date with where I'm at, sort of thing.
If the child, needs to go to hospital, they're going to be questioning, or have you ever experienced any of that? That attitude, whether it be by a medical professional or anyone else, for the decision that you've so far decided to take?
Look, we have times where we've had to take the kids to hospital for, one had a viral-induced breathing asthmatic kind of element, which is quite common in kids, and having to take the child in, and you have the nurse, in the triage area, and the nurse is going through all your records, and they ask us, the immunisation up to date. Not to be playing semantics, I often feel like saying, what is vaccination? Immunisation is another scientific term, but when you do sort of say no, the child's not vaccinated, you kind of get this double take, this double look, and I think sometimes there is a bit of a disconnect because I can present quite professionally and quite well dressed and professional, and I think there's sometimes a disconnect because I think some, either in the medical or elsewhere, often will look at you and just go, we just don't fit the profile that's been implanted in my mind as someone who doesn't vaccinate. You just don't fit that profile. But you must be one of those anti-vaxxers, or you must be one of those vaccine-hesitant parents who just doesn't understand the knowledge base like we do as a community. So you sort of, whether I'm getting that directly from the doctors, I probably get more, not respect is not the right word, I do get more, okay, just an acceptance. There's only one time that one of the children did have a infectious eye condition not related to, the vaccination diseases. To have it, wanting to have more of a question and more of a dialogue, and which I was more than happy to do as well. And other than that, not that much.
In the next episode of Between Clinical Minds, we continue the conversation on childhood vaccinations with Dr. Elizabeth Mumper, who details her altered vaccination schedule, and naturopath Amanda Howe. Thank you for listening. We hope this podcast engaged and empowered you. And thank you to all of our experts. You can read more information on each of them on our website, bioconceptsengage.com.au. If you enjoyed this episode of Between Clinical Minds, please refer a friend and share the love. To continue the conversation, you can contact us at bioconceptsengage.com.au, where community is more than a concept.